Today we're going to be talking about the social determinants of health, what they are, what that means, and why it is important in determining someone's physical, mental, and emotional well-being throughout the course of their life.
According to the CDC, the social determinants of health are all of the non-medical factors that cause influence to one's health outcomes. Limit to one's care is predetermined by environmental conditions including where they are born, their occupation, their age, and uncontrollable components inclusive of their biological framework. Essentially, data utilization and policy creation is a key driver to help combat existing systemic disparities in the United States. These metrics measured for advocacy of policy are healthcare access and quality care delivery, education, social community context, economic stabilization, and one's neighborhood and pre-existing environment. Throughout this presentation, prevalent examples will be set to explain the impacts attained as a result of these unequal determinants that are deeply rooted in our culture.
Today, we're going to use the story of George and Gary, identical twin brothers, to illustrate how social determinants of health can lead to different health outcomes. George was adopted by parents who didn't go to college and worked minimum wage jobs. When George was little, they couldn't afford food occasionally, and they experienced housing instability. Due to the stress and financial hardship, George had a lot of trouble focusing on his studies. He had to work to help out his family during high school, and as a result, his grades got worse and he wasn't accepted into college. Gary, on the other hand, was adopted by high income, highly educated parents. When he was little, he went to private schools for kindergarten and elementary school. He received a lot of support from his family and teachers and was making good grades in school. During high school, his parents paid for private SAT tutoring, and as a result, Gary achieved a competitive SAT score. He got accepted into an Ivy League college. Because of their differences in education, George and Gary will have different life choices and health outcomes. Education is key for social mobility because it allows a person to find a well paid job with great benefits, have higher income and wealth, and be able to afford living in a safe neighborhood and have access to social resources and financial resources. All of that will contribute to better health outcomes. As you can see on the graph, the higher the level of education, the fewer physical health problems a person reports.
Economic stability consists of 4 key factors, including employment, food security, housing stability, and poverty. Higher economic stability is linked with better health habits and outcomes as it determines what housing, neighborhood, food, and education an individual has access to. The graph here demonstrates that lower income groups perceive their health poorly compared to higher income groups. Education is a social determinant that influences income and economic stability. Due to George's lack of education, he has limited job opportunities and is earning a minimum wage salary. Similar to his experience with child poverty, George cannot afford to meet basic needs such as adequate housing and food. As a result of his financial hardship, George suffers from chronic stress, substance use, and mental health symptoms. Low-income groups use preventative health care less due to out-of-pocket costs. By living in poverty, George is at higher risk for physical limitations, heart disease, diabetes, and other chronic conditions. Gary has had access to higher education and has had better job and income opportunities. Gary's income provides him with the resources needed to pay for the best housing and food in his area. Gary is able to access preventative care easily as he does not have any issues with paying medical bills or prescriptions. As a result, he is more likely to have better health outcomes. Lastly, Gary is at less risk for mental health symptoms as he does not have financial stress like George.
George, living in Kentucky, is more likely to get cancer and more likely to die from cancer than Gary, who lives in New York. As you can see, the cancer mortality rate in Kentucky is 181 per 100,000, while in New York, the cancer mortality rate is 125 per 100,000. So what may motivate George to move from Kentucky to New York? Well, the poverty rate in population without insurance is only slightly lower in New York than it is in Kentucky. However, New York ranks number 9 in healthcare quality and access, while Kentucky is near the bottom at number 46. This takes into account population without insurance, where both Kentucky and New York are closely matched, but also preventable hospital admissions, which New York has almost 1,000 per 100,000 less than Kentucky, and health factors such as obesity, in which New York is 12% points lower than Kentucky. Additionally, if you live in New York, you have 23 hospitals with certified cancer programs to be treated, where in Kentucky you only have 13. As you can see, George living in Kentucky is more likely to have health risk factors for disease such as obesity, more likely to end up in the hospital with a condition that could have been preventable, have less access to hospitals for cancer care, and overall have worse health access and quality, highlighting how geographic healthcare access and quality can affect both disease, outcome, and mortality.
So although George and Gary are not real, the factors and systems that affected their respective paths in life are. That is why policy must begin to change, and there are certain goals that should be met and advocated for. Advocating for this change is crucial for several reasons, as they can have a profound impact on various aspects of society. Chief among them is making a systemic impact. Policies are the rules and regulations and laws that govern how we as a society operate. Changes in policy can lead to widespread and systemic improvements. Chief among them are addressing the systemic inequities that exist across all types of systems in the United States, such as healthcare, housing, vocational opportunities, and higher education. Addressing these inequities can bring about structural change across these institutions and organizations. They can help shape their practices and behaviors and make shifts in how systems operate. These shifts will create policies that provide a framework for sustained and long-term change, and not just the favored band-aid solutions that people in power seem to favor nowadays.